can there be a reason that some women would see positive effects from supplemental progesterone and then other women maybe would not?
Some women have a much higher need, and many of the products simply aren't able to deliver enough progesterone to be effective. In, I think it was 1951, there was a study of using the commercial progesterone that was available at that time for treating uterine cancer. The treatment, it turned out the doctors examining the changes saw just remarkable improvements in the uterine cancer, but they were giving what they considered to be a maximum dose, many injections of I think it was a couple hundred milligrams per injection. They would give several of those per day, but they never mentioned that the patient was being anesthetized, or they didn't even mention a sedative effect. But it's now recognized that when you get the amount of progesterone that the placenta produces in the latter half of pregnancy, those amounts of progesterone are strongly affecting the nervous system, preventing childbirth pain, for example, with an actual anesthetic effect, and having a sedative effect, improving the quality of sleep. So what they were demonstrating in that 1951 study was that even injecting hundreds of milligrams of progesterone, it wasn't being available to the bloodstream. It was dissolved in oil, and it was simply staying in the muscle or fat tissue where they injected it. And when you take it orally in a powdered form, the particulate, even micronized progesterone, as it touches the lining of the intestine, it's a small amount of it is passed into the cell structure, and in that form, in the intestine, and as it moves from the intestine to the liver, in that form, both the intestine and the liver have the enzymes to solubilize it, the way the liver handles estrogen. And so any of the powdered estrogen or progesterone preparations that touch the intestine tend to go into the soluble form and leave the body quickly. And if it gets into the circulation as a sulfated progesterone, that will have its own sedative effects, but definitely doesn't follow the metabolic pathway that natural progesterone produced by the ovaries or in the brain would have. And the closest you can get to a natural supplement of progesterone is when it's dissolved in oil and taken orally. The digestive system has the ability to break it up into micron-sized particles for absorption directly through the intestine into the lymphatic system, where those particles are transmitted directly to the bloodstream. So it circulates as fat-dissolved particles through the general circulation, bypassing the liver repeatedly, because red blood cells and these chylomicron particles are not recognized as something for excretion. They pass through the liver over and over and can be absorbed by the uterus, brain, all of the tissues.